Hey, sir.
I wear that.
Take a breath for me.
I wear that.
You said you're a patient, right? Let's talk about it.
I'm a patient. They let me sit inside for hours. Nobody cares.
I get that you're frustrated, but yelling out here isn't helping anybody. Let's step back inside.
No, you're not listening. Don't touch me.
Sir, keep your hands where we can see them.
June 18, 2024, Mercy General Hospital, Chicago, Illinois. It was a warm summer night around 11:32 p.m. outside the emergency entrance of Mercy General Hospital. The air was heavy and humid, and the bright white lights above the emergency doors illuminated the driveway where ambulances regularly arrived with critical patients. The sound of distant traffic mixed with the occasional beeping of medical equipment coming from inside the hospital. This police body cam footage begins when officers were called to the hospital after security reported a disturbance outside the emergency entrance. According to the report, the man involved in the situation was Michael Harris, a 36-year-old Chicago resident who had arrived at the hospital only minutes earlier. Earlier that evening, Michael had been at home when he suddenly started experiencing intense chest pressure, dizziness, and difficulty breathing. At first, he believed it might just be exhaustion. He had been working long hours during the week and assumed the symptoms would pass after some rest. But over the next 30 minutes, the discomfort only became worse. The pressure in his chest grew stronger, and he began to feel lightheaded. Concerned that something serious might be happening, his wife insisted they go to the emergency room immediately. By the time they arrived at Mercy General Hospital, Michael was clearly in distress. Witnesses later said he appeared pale and sweaty, and he was breathing heavily as he stepped out of the vehicle. The problem began when Michael walked directly into the ambulance loading zone instead of heading toward the main emergency check-in desk. The ambulance lane must remain clear at all times so paramedics can quickly unload patients who require immediate treatment. Hospital security quickly approached Michael and asked him to move toward the designated patient entrance where nurses could register him and begin medical evaluation. But Michael, already overwhelmed by pain and anxiety, believed he was being delayed from receiving urgent help. Body cam footage shows Michael pacing near the ambulance lane, holding his chest while raising his voice in frustration. He repeatedly told security staff that he was a patient and needed medical attention right away. Hospital security attempted to calm him down, but when the situation became louder and more chaotic, they requested police assistance to help manage the scene. A few minutes later, 2 officers arrived at the emergency entrance. From the officer's body cam perspective, the flashing red and blue lights of a parked ambulance reflect across the pavement as the officers approach the scene. Several nurses stand near the sliding hospital doors, watching carefully, unsure whether the man is creating a disturbance or suffering from a medical emergency. One officer calmly walks toward Michael and begins speaking to him in a controlled tone. He asks Michael to step away from the ambulance lane so medical staff can continue moving patients safely into the hospital. But Michael's frustration had already reached a breaking point. "I'm not causing trouble," he says loudly while holding his chest. "I'm a patient. I can't breathe. I need help right now." The officer maintains a calm posture and continues speaking slowly, trying to de-escalate the situation. Body cam audio captures the officer explaining that doctors inside the hospital are ready to help, but Michael needs to move away from the ambulance loading area so paramedics can continue their work. Michael's breathing appears heavy and irregular. His voice shakes slightly as the pain and panic begin to take control. Meanwhile, hospital staff watching from the entrance begin to realize that the man may actually be experiencing a serious medical condition. Within moments, a nurse quickly brings a wheelchair toward the officers. The situation immediately shifts. The officer signals to the nurse and helps guide Michael toward the wheelchair. Michael appears exhausted and slightly disoriented as he slowly sits down. Once seated, medical staff quickly wheel him through the emergency doors and into the hospital, where doctors are waiting to evaluate his condition. As the body cam footage ends, the chaotic scene outside the hospital begins to settle. What initially appeared to be a loud disturbance outside the emergency entrance was actually a man struggling through a frightening medical emergency. Moments like these can unfold quickly and create confusion for everyone involved, officers, hospital staff, and patients alike. But in this case, calm communication and quick cooperation between police and medical staff ensured that Michael was able to receive the urgent medical attention he needed.